Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you once again for having me on this program.
Yes, sir. Let's just address what's in the news. Could we get a quick update on Uriel and Siparuta?
Well, Oriala and Siparuta, as you know, we had discovered a number of cases there, and we are taking the necessary precautions. Currently, we have 34 active cases, and we are going to continue to monitor them. They're predominantly from Siparuta. So I think the village council themselves have decided that they're going to restrict movements between the two communities, and of course, from Siparuta coming out, say, to Skeldon. In addition to that, we have a medical team on the ground that has been working with the community, doing COVID-19 education, providing support, medical support, and also doing testing. So we did actually a lot of testing in the community, and that's how we have found that there are 34 persons who are positive. Some of these persons have already, been monitored, and they're already maybe about 4 to 5 days into that monitoring period, and they're all asymptomatic. So we'll continue to do that.
Okay, good news. Could we talk about St. Cuthbert's mission?
St. Cuthbert's mission, as you know, we had extended the lockdown, so to speak. And we continue to have our team on the ground to monitor what's happening. We were very happy yesterday to discharge a number of persons. So we are now down to 20 active patients. And I think that's a testimony to the good work that the doctors and the village council have been doing over the last 2 weeks at St. Cuthbert's. So we just have to wait maybe a few more days, and then we'll be able to lift the lockdown. There might be 1 and 2 cases that we'll still have to monitor. Yesterday we did 35 PCR tests, of which we saw 2 persons coming back positive. So we'll still have to do some monitoring. But I guess by the end of the week, we'll be able to review our posture on the lockdown and perhaps lift the lockdown because the numbers have changed significantly.
Okay, thank you, Minister. What about the dorm schools? Could we get a quick update on those?
Again, the children who came into the dorms, several of them have tested positive at various locations, and we identify them, we have isolated them, we are monitoring them, and once they complete the period of isolation, we'll get them to return to the general dorm population. All the children have been asymptomatic, so we just have to await until they complete the period of time, which is normally about 10 days, and then they'll return back to the general population of the school.
And I know that the ministry was doing the contact tracing and
Yes, we did. So the parents of these children were informed, persons in the community, persons who they might have come in contact with. So that was done, and those persons have been in quarantine and are being monitored.
Thank you. Minister, today we wanted to ask you to address testing in Ghana. We know that there are 2 facilities that were certified. Of course, the National Public Health Reference Lab is one of them. So we want to talk to you about where we are today in terms of testing. I know our capacity had increased significantly, so let's start there.
Yeah, we, in the public sector, the National Public Health Reference Lab was at one point would only be able to do like 96 tests in an 8-hour period. Fortunately, with the investments that we have made there, new equipment and so forth, we are now up to 450 tests to 600 tests per day. We can do that easily in an 8-hour shift. And if we run 3 shifts, we can easily increase the volume of tests that we can do in a 24-hour period. So you would recall that earlier in the response, we were only able to do like 21 tests per day, so we have increased significantly. We are awaiting a piece of machinery that we have ordered, and when that come into the country, when we get it, we would be able to increase our capacity even more. So within an 8-hour shift, we will probably be able to do uh, between 1,000 to 1,200 tests within an 8-hour period. So this, in the public sector, this is a significant improvement from where we were a couple of weeks ago. And right now, on an average day, we probably do about 400, more than 400 tests from various testing sites that we have. And we'll have the capacity to ramp up. If we need to add more mobile testing sites, we'll be able to do that. And of course, people are getting back their results within a 24-hour period. So not only have we increased capacity, but the turnaround time for the tests has also improved. So I think so far they've been doing an excellent job, and we are going to continue to build the capacity at the National Reference Lab. Apart from the PCR testing, there is also antigen testing that is now becoming available. Antigen test means that a part of the virus is being tested for, and so this is the actual virus that we are looking for. These tests, we have two types that we'll be introducing this week into our testing repertoire, and that is one of the tests from Abbott Laboratories. Those tests would take about 20 minutes to complete. So from the time you're swabbed and that swab is processed, it would take about 20 minutes for you to get a result. So that would improve the turnaround time to know whether somebody is positive. So we'll introduce those tests starting from this week. And we also have another test that we have acquired through PAHO WHO, and similar to this rapid test, but from another manufacturer. And that test is going to be between 20 to 30 minutes. So they're both fairly rapid and fairly accurate, and we'll be deploying this. And we have set up a protocol of how we will use these specific antigen tests. So I'm very confident that we would, really improve the testing capability with the introduction of these rapid tests.
Yeah. I know when we spoke a few weeks ago, the ministry had ordered, so just confirmation, did they arrive, those tests?
We are getting them this week. So we have had discussions with the people who we bought it from, and they have promised us that it's going to be here during this week. In the meantime, some of our staff has already been identified to undergo training to utilize the tests.
All right. I know for confidentiality purposes, you might not be able to tell us some of the companies that would have applied for certification. However, once certification is given for a company, how can the public know? Is there a certificate that is displayed and so on?
Well, the ministry, through the Standards and Technical Division, once they do an inspection of a facility and deem it to conduct their business, they would be given a license. And that license should be properly and prominently displayed in the business. So we have been doing that. We have teams of people that would normally go out and certify health facilities, hospitals, different medical centers, laboratories, and so forth. And what they do when they go out is to check to ensure that all the necessary things are in place. They have the personnel, they have the equipment, they have the safety measures, and so forth. So once they meet this standard, they'll get the license. So that is something that the standards and technical division has been engaged in.
Minister, we know that once a person believes they've been exposed, that government has facilities in place. What if a person wants to go take a test and might not want to go to one of the sites the ministry would have indicated? What do they look for, and what are some of the questions they should ask a practitioner with regards to testing?
It's simple. We are giving people options. So one option is if you tested positive and you don't have the conditions at home to properly isolate yourself, and you believe that if you stay at home, you will expose your family members, then you can come into one of our isolation facilities that we have, and we have them in every region of Guyana. So that's the first option. The second option would be if you have the facilities at home, then we allow you to stay home. Most people prefer to stay home because they have more comforts at home. They feel it's a familiar environment and things like that, and that's what most people have opted for. Now, while they're at home, we have teams of people that would call to find out how they're doing, and in terms of whether they're having any signs or symptoms, and so forth. So that is a two-way process where we call to ascertain the person's health status. But if the person, for whatever reason, feel that they have a deterioration in their status, let's say that feel they're not breathing properly, they can call our hotline, and we have medical persons that are manning our hotline. We have on a 24-hour cycle, we have doctors who are manning the hotline. So they would be able to provide that person with up-to-date, accurate medical consultation on the phone. And by doing that, we would be able then to advise them whether to stay home, whether to come to one of our facilities so that further actions can be taken. So that has been the process. So you don't have to wait until somebody calls you. If you think you have a challenge, then call the hotline, and you'll be able to speak with one of our doctors, and they can advise you on what to do. And it's not only for the persons who have tested positive. If you have some question that you want to ask, then call the hotline and ask your question, and they will help you. What we, however, don't want, because we have had people who have been calling the hotline with crank calls. They just call and take up valuable time, and we want people to avoid that. So if you really have an issue that you're worried about, you're anxious about, and you want to discuss, call the hotline, and they'll provide you with that information.
And for the entity that you're going to, what do I ask them? Let's say I'm going to a private hospital and I want to do a test. Should I ask them for their certificate that says they are able to do the test?
Well, I don't know where you want to ask them.
The reason I'm asking, because a lot of time we don't ask those questions. We assume this entity may be advertising, I can go to them. And I think that has been a problem for a long time. So, and it goes back into what I asked earlier, how do we know a company is certified? They have to display that certificate.
So when we certify a place, we wouldn't say this place is certified to do A or B. We certify them generally as a laboratory or something. So that's one thing. But basically, what people need to understand with COVID and testing for COVID, there are three broad categories of tests. Let's simplify it. So the gold standard for testing is something called a PCR test, which is what we have been using. So far, there are only 2 laboratories in Guyana that has been certified to do PCR testing. Secondly, there's another type of test called an antigen test, which is fairly quick. So in some cases, it takes about 20 to 30 minutes to do. but it also looks for the virus, right? Those tests are now being introduced into Guyana. And we in the public sector are starting that introduction. So as of the end of this week, early next week, we'll be rolling out this rapid antigen test. Now, I'm sure there might be labs who would start bringing in rapid antigen tests once they meet the criteria, because WHO has established some criteria for these types of tests as well. We would check, whoever want to use them would contact the ministry. We'll go through a process of vetting it. Once it meets that criteria, we will allow it. So I'm sure after this week, next week, you'll start seeing some private sector entities who would be offering the rapid antigen tests, right? So that's a second type of test that is available. Then there's a third type of test, and that is if you got sick with COVID, then your body would react to the virus. And when your immune system reacts to the virus, it produces something called an antibody. And you have a category of tests that would check somebody to see whether or not their immune system would have developed antibodies. Now, this would have come after you would have been infected, after you are non-infectious, and then you see these antibodies coming up. So in a very simplistic way, we have these three types of tests. PCR, which is what we say is the gold standard, because this can accurately diagnose whether somebody has COVID or not. And it's usually done at the start of the disease process, right? And it's very accurate at the beginning of the disease process. Antigen tests are not as accurate as PCR, but are very accurate and they're very quick. So if we have any doubt when we do an antigen test, we can always revert to the PCR test to make that diagnosis. And then the other category, which is the antibody test, a number of places have been using them, but these are people who would have had the infection and are now probably recovering. So they're not used, these antibody tests are not used for diagnostic purposes. It can be used to screen people to see whether or not they had this infection in the past. Okay, so that's the three types of tests that we have and that has been available. So I hope that when people go and they're asking for a COVID-19 test, that they know exactly what is required. Because if you go and you get an antibody test, that is not necessarily going to diagnose whether you have COVID or you don't have, So it's not a diagnostic test. It just tells you if you had an infection with COVID.
All right, Minister, thank you so much for that clarification. I wanted to ask you another question on the testing. For the purpose of traveling, where do people go to get those? And is it necessary for employees to do continuous testing? I don't know if continuous is the word, but to do testing often then?
Right. So the first one dealing with travel. In the National Public Health Reference Lab, that's not our priority. So if people come to us and they do the tests and they get back the results, that's fine. But that's not our priority. Our priority is to find out whether or not there are people within the country that test positive, and we want to control the epidemic here. Most people probably who want to travel and go abroad, they're probably negative, but they need this for the purposes of traveling, and we are not specializing in that. So if people need PCR for travel purposes, they should seek to do that in the private sector. So that's with the travel. In terms of people returning to work, we've had cases where somebody would have tested positive, stayed home, and then having completed the period of isolation, to return to work, there are some employers who are asking them to get a negative PCR test. Our national guidelines, which is following the international guidelines that is established by the World Health Organization and PAHO WHO, well, PAHO WHO, does not require you to do a second PCR test. What we have is a protocol, so if you remain asymptomatic for 10 days, on the 11th day you can be discharged and you're going to be non-infectious. If, however, you do display some signs or symptoms, then we wait 3 days to see that you're asymptomatic. And once you're asymptomatic, we then discharge you. So there's no requirement for you to go back and do a PCR test. So I think if people are insisting on that, it's really a waste of our resources because we want to focus on identifying people who would be infectious. And this here is not identifying those persons.
All right. Minister, as we get ready to wrap up, I wanted to ask you about face mask. And there's a difference between the one I'm wearing to the one that you're wearing and the cloth one that we see everybody wearing. Could you guide us along as to how all function?
Well, face masks are necessary to prevent transmission. COVID-19, basically it's, when somebody sneezes or cough, you will have droplets that would leave their mouth and can go and infect the other person once they're within range. Apart from droplets, there's smaller particles called aerosols. And these particles are very tiny. They can literally float in air and remain suspended in air for an hour longer. So if you're in an enclosed environment, some of these particles can remain suspended for a little longer. And therefore, somebody coming into the room can breathe those particles and become infected. So the way to prevent all of this is for you to, at all times, wear your mask, especially in indoor environments and when you're in crowded spaces. There, as you rightly pointed out, there are varying types of masks. The easiest one that people can make at home is a cloth mask. A cloth mask would help in a physical sense to prevent droplets from getting to your face, and for you to, breathe in those droplets and things like that. So that helps. All the masks that we have, cloth, surgical or procedural mask, N95, they all help. So the cloth one would help us with that kind of situation with droplets and so forth. They're not as effective against aerosols, which is the tiny particles. And so that's something that people will have to bear in mind as well. Surgical or procedural masks, they have about 3 different types of layers in it, and they're more effective than a cloth mask. So these ones would help to filter out not just droplets, but aerosols, and if worn properly, would prevent you from getting infected with these tiny particles. The N95 one, it's also very effective, and it's called N95 because 95% of the particles it filters out. So it's highly effective. And in some of the, while we call them N95, some of the manufacturers are guaranteeing that they can filter out as much as 98% of the particles. So these are highly effective. But despite whatever it is. N95s and surgical masks are the ones that we'll use more in a hospital environment because your chances of being exposed to a person with COVID is higher in these environments. So you'll want to use your N95 in high-risk environments. In lower-risk environments, like walking around and so forth, cloth masks are sufficient. And we have seen when you introduce cloth mask and everybody is wearing it, that it has led to a drop in infections in those communities that wear them. So all masks are helping, and that is why we have been insisting that people wear their masks. And if they do that, I think we will, we will see a reduction in the cases of transmission. And as we're on that, one of the things that we can perhaps think about this Christmas is to give a mass for Christmas. So perhaps we'll have to start a campaign where we can encourage people. The best way you can share and enjoy a safe Christmas is to give a mass to a friend or a loved one.
Thank you, Minister. I love that idea. A mask is cheap too, but it's going to save a life.
Exactly.
Minister Anthony, thank you so much for speaking with us. We always have a host of questions for you, but you've been gracious enough to answer, so thanks again.
Thank you.
All right, well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.